Bore da pawb, and good morning all. Thank you very much for your introduction, Andrea. I am delighted to be here with you today celebrating 10 years of health and care research Wales. The reason why I'm really delighted to be here is I'm very passionate about research, and I hope that I will be a really good champion for the work that you do in my new role. I've been in this role for about 5 months, so I'm still meeting many of you, and I was very interested and excited to see the work that each of the centers are doing just now as I've been going around the stands. So congratulations for the work that you're doing. This important annual event provides an opportunity for our scientific community to get together and to share ideas and develop new collaborations. So I would encourage you to go around the different stands and talk to other researchers about the important work that they're doing. Today's research is tomorrow's care. Research and development is vital to secure a healthier Wales. Research drives innovation, helping us solve the problems that we face today and showing us what works best to meet the needs of the populations that we serve. I don't have to tell you that the population of Wales absolutely needs and deserves better health outcomes, and the research that you do is critical to help us secure that. Research is enabling earlier diagnosis and resulting in new and better treatments. An environment where research thrives is good for professionals as well as for patients. In these environments, professionals are more satisfied and continue to develop their expertise, enabling healthcare systems to meet the evolving needs of the population and securing overall better health. High-quality research attracts external investment from grants and other income from, for example, industry. This has got wider benefits for our communities. And for all these reasons, I have ambitions to build on the great work that you've done for the last 10 years to create an ecosystem where research and evaluation thrive for the population of Wales. But today, I'm going to focus on reflecting on the key achievements over the last 10 years, as I see these as a solid foundation for a great future for research in Wales. And I thank everyone in our research community who has played a role in designing and delivering the wide range of studies and activities over the past 10 years. An incredible amount of work has taken place through partnerships between Health and Care Research Wales, academia, industry, and NHS and social care organisations to advance our shared goal of securing a healthier and fairer Wales. Today, we are also launching our annual report for 2024-25. It has been endorsed by the Cabinet Secretary for Health and Social Care, Mr. Jeremy Miles. So, reflecting about the past 10 years, what I'm going to do is go through 10 key achievements that we have seen since Health and Care Research Wales was established. Number 1, the Health and Care Research Wales centres. I've visited a few of you in just this morning. Over the past 10 years, we have consolidated and enhanced our investment in a research development infrastructure for Wales. We are currently funding 18 centres in areas of health and care need in Wales, but also where we've got scientific strengths and expertise. As you saw in the video, this is an investment of about 50 million over 5 years, with an expectation that these centres will be a catalyst helping bring 4 to 5 fold return of investment, attracting additional funding into Wales. Our more recent investments include a Women's Health Research Centre and a National Centre for Suicide Prevention and Self-Harm Research, aligning with our own national strategic priorities. And I'm pleased to say that we now fund 3 social care research centres. Cascade in children's social care, care in adult social care, and more recently Scale, which you will hear about today and which looks at the application of AI in social care settings. Number 2 is our funding schemes. As a research funder, we have enhanced our funding schemes, offering grants for impactful projects that answer issues specific to us in Wales, and also for pilot feasibility and developmental studies that will feed into larger competitive funding applications to NIHR and other funders. We have continued to invest in a range of NIHR funding schemes to enable you, Welsh researchers, to compete for UK research grants through new agreements with the Department of Health and Social Care. Number 3 is recruitment to research. In the past 10 years, just over 175,000 people have participated in health and social care research. Imagine if we could expand that for the benefit of the population of Wales, where participating in a clinical trial, was the default and not the exception. These studies are wide-ranging, testing new diagnostics and treatments or designing new care pathways. As you know, the COVID-19 pandemic required a huge health and care research effort in Wales, and we supported 119 COVID-19 studies, and we are grateful to the more than 60,000 people in Wales who took part in COVID-19 research. I know that was an extraordinary time, and we don't want to go back to those terrible pressures, but it does show also the art of the possible, what can be achieved with concerted effort. Our funding supports over 600 research nurses and other research support staff in Wales who work with the wider health and care workforce to enable research participation and secure patient benefit from participation in clinical trials. Number 4 is the development of commercial research delivery Wales. As you know, collaboration between the public and private sectors is key to delivering greater health gains from medicines. As part of the new UK voluntary scheme for branded medicines pricing and access, which is a mouthful, BPAG for short, Wales is receiving around 22 million over 5 years. And we're using this funding to establish a new commercial research delivery centre, acting as a national network for pioneering clinical trials in Wales and creating opportunities to test innovative new treatments with the latest equipment and technology. The funding has allowed us to build capacity and capability across NHS organisations, enabling us to step up our ambitions as a great place for industry to come and do their important research. Our partnerships with Moderna and BioNTech in the exciting new area of therapeutic vaccines are good examples of the growing offer from Wales. Number 5 is our Health and Care Research Wales faculty. In 2022, we established the Health and Care Research Wales faculty to improve research career pathways. This is a core pillar of our ambition to build a world-class health and care research system. The faculty brings together all of our personal awards, such as doctoral and advanced fellowships, and research time awards, providing wraparound support and a tangible community for its members. Number 6 is the SAIL data bank. Through Health and Care Research Wales and its predecessor organisations, the Welsh Government has invested in SAIL, the Secure Anonymised Information Linkage Data Bank at Swansea University since its inception in 2000. I've been talking too long, 2007. SAIL is among the richest population data banks in the world. Its richness enables important questions to be comprehensively answered. The expertise and services available to support research have been at the forefront of UK developments and have built an international reputation. SAIL provides a platform for impactful research across many of our funded research groups in Wales and is a major contributor to UK initiatives such as Health Data Research UK and Administrative Data Research UK. This is one of our assets, not the only one, but I think we have a duty and a responsibility to make the most of these assets for the population of Wales. Number 7 is partnerships and collaborations. Through our 10-year history, we have sought to build collaborations with other research funders to increase opportunities in Wales. There are many examples, including cross-funder initiatives like the UK Prevention Research Partnership. We co-fund with Cancer Research UK an experimental cancer medicine centre at Cardiff University. With the British Heart Foundation, as you heard, we co-fund the National Cardiovascular Research Network, and I could mention a number of others. Research is best done in partnership. Number 8 is public involvement. Meaningful public involvement ensures that research is relevant and meets the needs of our population. When I took on my role as Chief Medical Officer, I was delighted to see Wales leading in this area. Researchers and public contributors from Wales have played a key role in shaping UK standards for public involvement. And as you saw in the video, we thank the almost 700 members of the public working with us as part of our research community, people who give their time and lived experiences to inform the prioritization, design, and development of research studies. We are proud of our Discover Your Role program, which has been co-designed with the public and for the public to take our public involvement to the next level in Wales. Number 9 is our inclusivity plan. Last month, I was very pleased to take part in the launch of our Inclusivity Action Plan at the Senate, when we announced our partnership with the Centre for Research Equity at Oxford University. As you know, health inequalities have a devastating impact in our society. If our research does not include and represent those who are most affected by ill health, we will continue to widen the health gap. Research is essential to inform the policies that we need to support our population and their health. And I am delighted to see the importance placed on the inclusivity agenda in health and care research in Wales. And I look forward to seeing the impact of our Inclusivity Action Plan on advancing our mission towards a healthier and fairer Wales. And finally, number 10 is our Health and Care Research Wales Evidence Centre. I was also delighted to see that we're learning and building on the lessons from the pandemic. The pandemic highlighted the importance of timely access to the best scientific evidence to protect health. We have built on the great work that was done during the pandemic to establish the Health and Care Research Wales Evidence Centre, creating a national resource that undertakes evidence synthesis and rapid primary research to answer questions of pressing importance for policy and practice in Wales. And only just 5 minutes ago, I was myself asking colleagues whether we could use the expertise in this center to answer a question that's coming up my way that's of important public health impact, which relates to the potential digital harms to children from excessive use of digital devices. So as you can see, this is great work over the past 10 years, work that provides robust foundations for Wales to become a leader in health and care research internationally. This year is the final year of our Health and Care Research Wales plan. Soon, we will be starting the development of our strategy for the coming years, and we will work with you to inform its development. Personally, I have big ambitions for research in Wales. As you know, today we face major public health challenges arising from socio-demographic changes, climate and environmental change, pressures in our health and care systems. But thanks to scientific advancement, we also have better tools and knowledge to respond to these challenges. Science and research need to be at the core of our efforts to secure Wales as a healthy and prosperous nation. The best research is done in collaboration, that is in partnership across disciplines, sectors, and nations. We must continue to build partnerships across the UK and beyond, and play our part in UK-wide initiatives, such as the UK Life Sciences Sector Plan, or the exciting development of the Health Data Research Service. We must understand our scientific assets and build on them. Our example is our genomics partnership, and I am delighted that soon we will publish our first genomics research plan. We must also do more to develop and communicate our offer to industry partners, and build on the last 10 years to create an environment where scientific partnerships and scientists and researchers can thrive. I came to Wales because I could see both a population that needed better health outcomes, but also great opportunities from robust policies and strategies and a culture of partnership and collaboration that would allow us to have a really good impact on health outcomes. And research needs to be at the core of that work. So my sincere thanks go to everyone in this room who is making a difference and playing a part in delivering our Health and Care Research Wales plan and our ambitions for a healthier and fairer Wales. I hope you enjoy the rest of the day and make the most of the opportunity to develop new partnerships and collaborations. Thank you.